My name is Dr. Joseph Bivens. I am a board-certified plastic and reconstructive surgeon. And I became a physician as an alternative to some of the other things that I was trying to do. My parents are teachers, and as I was embarking upon my career in professional tennis and professional music, my parents decided that medical school was probably a better option. And being the wonderful son that I am, I decided to listen to them. So therefore I went to medical school, and I actually graduated from medical school, and then I embarked upon a career in surgery. And I am a plastic surgeon, specifically with the interest of managing the body. And I rebuild the body. I tell people all the time, if Humpty Dumpty falls, I'm the guy you call, because I put him back together. Well, the specialty that I utilize at Pioneers is really reconstructive surgery. I'm a plastic surgeon. I'm a board-certified plastic and reconstructive surgeon. And unfortunately, a lot of people don't really understand what that is. Yes, I do nose jobs. Yes, I do breast reconstruction and everything else. But here, I focus on complex wounds. With the population in America, and specifically here at Pioneers, we have many, many patients who have diabetes. We have many patients that have arterial deficiencies, and that results in ulcers of the lower extremities and the legs. And so one of the things that I'm able to do is to utilize those skills in plastic surgery and reconstruction to help assess, analyze, and then treat the wounds of the lower extremity in particular. The reason I like being a doctor is, number one, flexibility. I'm not forced to a 9 to 5. I don't like punching a clock. And by being a physician, it gives you an opportunity to work 24, 12, 8, 6, whatever. But it also allows me to become involved in the science of what keeps a body functional. I can utilize science, I can utilize art in the form of plastic surgery, and sometimes even just common sense. The types of patients that I treat here are patients that have metabolic diseases, diabetes, and the sequelae or the consequences of diabetes, obesity, the consequences of obesity, congestive heart disease, and peripheral vascular disease, and the consequences of those things. And those typically create wounds. And it's those types of wounds that I manage here at Pioneers. The services that I perform here pertain to managing the wound, but at the same time, I have to become involved in the total patient. I not only just look at the extremity, but I want to know more about the patient's life. I want to know how they function. I want to know about their family. I want to know about their diet. I want to know about their psychological state, because all of those things come into play whenever I have to heal a wound. The wound just doesn't heal just by my efforts. And one of my professors would always say, all wounds heal. I don't care what you do, they all heal. But we're the ones that stop them from healing. We stop them because of emotional issues, family issues. I've had patients that walk into my wound center and I look at the wound and I say, well, why isn't this wound healing? And they say, oh, my cousin talked to my neighbor who talked to my friend across the street that said if you use bees' wings on the wound, it'll do better. Well, all of a sudden I have to get involved in that aspect of it and try to get people to understand I really need their cooperation. So I need cooperation of everything. And that's what's so interesting and so stimulating, and at the same time challenging in all communities, but especially in this community. The best part about working at Pioneers is no traffic. I trained in New York City. I then trained in LA, I trained in San Francisco, and I trained in San Diego. And one of the things, when you have large populations of people, you have a lot of congestion. But at Pioneers, what we have is a small community. We have the closeness of the physicians and the staff, and that's one of the good things about being at a smaller facility in a smaller city.